Right, we are about to demonstrate to you the ReTurn 7500 standing aid, and the ideal patient for use with this has to have weight bearing capability and a reasonable sense of balance. So the ReTurn is brought up to the patient's chair, the brakes are applied, and the patient's feet can be assisted, or they can do it under their own steam, onto the foot plate, and the patient then grabs the handle and, perhaps with a bit of assistance, is brought to the standing position. The patient can then hold on to the handle, the brakes can be released, and the patient can be moved to a new location to be transferred onto either bed, chair, or other seat. To return the patient to a seating position, the ReTurn 7500 is now brought to the chair, and the patient shins lined up against the seat. The brakes are applied. The user, or the carer, stands on the bar to balance the stand aid, whilst the patient, using the horizontal bars, can gently lower themselves safely onto the seat. So for patients that have unstable balance or are at risk of falling, we can use the ReTurn 7500 belt. Make sure that the arrow is pointed down, and these can be fitted while the patient is seated with the belt under the patient's bottom, and then the Velcro straps attached at the waist, and then the patient is able then to be moved using the belt to secure the patient to the post as they're being lifted. Is now fitted securely to the patient. Please note, when you place the Velcro strap, that we abide by the minimum on the strap here so that we've got secure fixing. And then the patient is then ready to lift. The brakes are applied. The carer can assist using the grab handles on the side of the strap, and then putting the strap over the pommel here to keep the patient secure. It can be tightened like so, and the patient can be then moved to another position. To reseat the patient, the ReTurn is brought to the chair as close as possible. The brakes are applied again, and the carer very carefully releases the strap over the pommel and lets the patient go down very gently into the seating position.